Hello, everyone. I hope that was enough time for everyone to come onto the Zoom. Sorry, we're a few minutes late, but just wanted to give a little extra time. But thank you so much for taking time out of your busy schedules to join us for this webinar about grants available through SAMHSA, the Substance Abuse Mental Health Services Administration. I am Shannon Rotenberg, and I am the Executive Director of Camilla and Matthew McConaughey's Just Keep Living Foundation. Camilla and Matthew started this Green Lights initiative through their foundation after Uvalde happened, and that was Matthew's hometown, and really wanted to see how he could use his platform and resources best to help keep all of our kids safe. I'm thrilled you will be with us all day today for this webinar. We know finding and understanding federal grants can be very, very challenging, and we hope to easily share more information on grants available for each department in this webinar and upcoming webinars. Today, we will go through Project AWARE, Advancing Wellness and Resiliency in Education, and Mental Health Awareness Training, grants identified through the Bipartisan Safer Communities Act. These grants are focused on providing increased mental health support to students and equipping teachers, parents, and community members with training to respond to and support individuals with mental health challenges and/or disorders. Matthew and Camilla are very excited you're joining in this effort to ensure America's students are safe, secure, and healthy. We really, again, appreciate your time, your passion, your commitment. We hope you find this helpful. We really, really welcome your feedback as well. And with that, I'm going to turn it over to the wonderful Stacy for next steps. So thank you again.
Hello, everybody. My name is Stacy Rubel, and I will be your facilitator for this course where we learn about SAMHSA school safety grants. And as Shannon said, these are really focused on mental health, less on, like, when we think about the public safety grants, the DOJ grants that we talked about last week, these are much more about mental health because it is coming from the SAMHSA area. So a little bit about me. I do have my own grant consulting business. I've been writing and reviewing federal, state, and foundation grants since 1995. I specialize in federal grants, so this is really my center of what I do, and specifically in justice, human services, and mental health fields. I was a grant administrator for the Commonwealth of Virginia and a grants manager for 2 statewide nonprofits. And lastly, I hold the grant professional credential from the National Grant Professional Certification Institute. Next slide. So what we're going to cover today is 2 Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, grants related to school safety and mental health. So I'm going to go over the overall intent, the specific requirements and required activities, budget considerations, with for SAMHSA is going to look a lot different than DOJ, and how to prepare. And just a caveat, all of this is based on the FY 2023 solicitations. So there could be changes in FY 24 if one or both of these do actually come out. We still have not gotten confirmation on that. Next slide. So I'm not going to read all these to you, but these are just some of the acronyms you'll hear us use. We love acronyms in grant land, so these are some of the ones that we'll be using throughout this class. And one of the ones you'll hear me referencing back to is the NOFO, the Notice of Funding Opportunities. That is what we call the solicitation, the document that comes out from SAMHSA that says, hey, we got money, come and get it. Next slide. Okay, so let's compare these 2 grant programs. Next slide. Okay, so you can see there's a very, very different grant programs from each other. So first off, we have Project AWARE, which is Advancing Wellness and Resiliency in Education. You can apply for up to $1.8 million per year. It has an up to 5-year period of performance. They're going to give out 75 awards. There is no match, unlike the one DOJ one we talked about last week. They do have a priority of having a suicide awareness and prevention policy, and this is a grant. And just as a reminder, I see that's popping up. These slides will be available, as will this recording will be available to you later this week. And if you have any questions, you can put them in the question and answer pod versus in the chat pod. Okay, then the other grant is Mental Health Awareness Training, or MHAT. This has up to $200,000 per year that you can apply for up to 3 years. They're only going to give out 22 awards. There's no match. There's no specific priority listed. And this is also done as a grant, not a cooperative agreement. Next slide. Okay, so for both of these programs, well, let me just go back a second. So the Project AWARE is specific to LEAs, whereas MHAT is going to be much broader and is specific to a lot of different entities in communities. So both do require that you use trauma-informed, recovery-oriented, and equity-based programs, practices, and policies. And those are actually thoroughly defined in the Notice of Funding Opportunity. You have to use evidence-based practices and have partnerships, and those partnerships differ between the two. And then you got to make sure that your LEA is registered with sam.gov, grants.gov, and for SAMHSA, you also have to be registered in ERA Commons. Next slide. Okay, so let's talk about Project AWARE first. Next slide. Okay, so the purpose of this program is to develop a sustainable infrastructure. So this is all about sustainability and infrastructure for school-based mental health programs and services. So you have to have relationships between the local education agency, state education agency, and the state mental health agency, and if applicable, also the tribal education agency. Plus, community-based providers of behavioral health care services, school personnel, community organizations, families, and school-aged youth. So this is really all about those relationships, which is one of the reasons why it is such a large pot of money. You then will need to leverage those partnerships to implement mental health-related promotion, awareness, prevention, intervention, and resilience activities to ensure that school-age youth have access and are connected to appropriate and effective behavioral health services. So overall, their goal is to promote the healthy social and emotional development of school-age youth and to prevent youth violence in school settings. So like I said, this is all about mental health. Next slide. Okay, so they have a number of goals. The first set of goals are, and these are in no particular order, these are just the order that they were listed in the NOFO. So first off, increase awareness of mental health, substance use, and co-occurring disorders among school-aged youth. Increase the mental health literacy of individuals who interact with school-aged youth to understand and detect the signs and symptoms of mental illness, substance abuse, use, misuse, and co-occurring disorders. And then promote and foster resilience building and mental health well-being for all school-aged youth. So increasing awareness, mental health literacy, and actually resilience building and mental health well-being in the youth themselves. Next slide. Then continuing on, provide positive behavioral health supports, targeted services to those who need more support, and intensive services to those who need them. So there's 3 different tiers. Then connect school-age youth who may have behavioral health issues, including serious emotional disturbance or serious mental illness, and their families to needed services. And then lastly, increase and improve access to culturally relevant, developmentally appropriate, and as I said before, this whole concept of trauma-informed school and community-based aware activities and services. Next slide. Okay, then they have a series of required activities that you have to do to be able to get this funding. And as you can imagine, with $1.8 million a year, there's a lot of them. So first off, it's developing that collaborative relationship that we already talked about, and it includes entities that serve primarily racial, ethnic, and sexual gender minority, serving community-based organizations. Then next, you need to do a needs assessment of the LEA and its geographic catchment area to determine what risk and protective factors are present, and then develop those partnerships as we've said before. Next slide. Okay, so what's interesting about this one is with SAMHSA, they always tell you who the quote unquote key personnel are. And so in this case, these are staff members who have to be part of the project, even if the project isn't paying for those staff positions. And so you have to have a 1.0 full-time equivalent, so 100% for an LEA project director. Then for the state education agency, you have to have 0.25 FTE at least. And then for the state mental health agency, you have to have 0.25 FTE. So you can really see how seriously they're taking those partnerships in that each entity has to commit staff time as well. Next slide. Okay, so now we get into the prevention and intervention tiers. So no later than 6 months after the award, so you don't need to have this going in, but you need to have it set up within 6 months. You have to have an implementation plan that's based on the 3-tiered public health model. You have tier 1, which is universal prevention and mental health promotion. So doing things before they happen. Tier 2, secondary prevention and brief intervention services. So something has happened and you're now doing brief response to it. And tier 3, you have tertiary intervention and behavioral health treatment. This is where it gets into intensive treatment. It has to also be culturally competent and linguistically appropriate. And then they give you the link to where you can find more information on what that looks like through a SAMHSA lens. And then it has to include the following, with each item infused with an equity perspective. So now we're going to go through what the expectations are for each of those tiers. Next slide. Okay, so tier 1, there's 4 different things that you have to do. You have to have a comprehensive mental health awareness program targeting youth, their families, and school staff that destigmatizes school climate, that is conducive to addressing the mental health needs of students, such as school-wide socio-emotional learning curriculum. Next up, you have to establish and implement a school-based student suicide awareness and prevention training program. You have to have a workforce capacity building plan that's going to increase the mental health awareness and literacy of school staff, administrators, parents, and anybody else who interacts with school-age youth. And then lastly, for tier 1, you have to have a comprehensive school safety and threat violence prevention program. Okay, so that's tier 1. That's the overall raising awareness and promoting awareness and literacy. Okay, tier 2. So this is where you're doing the brief intervention. So develop a process to screen and identify school-age youth in need of mental health services and supports. So screening to identify them, and then doing brief intervention services to support school-age youth who are experiencing distress, trauma, or bereavement, or are at risk of development of mental health or substance use disorders. So screening and brief intervention is tier 2. Next slide. Then we have tier 3. So this is when you've actually identified a problem and you're doing more serious intervention. So having referral pathways to ensure that school-age youth that do require more intensive services are referred to, and have a crisis response plan that the LEA can implement to respond to immediately if you do have school-age youth that are exhibiting behaviors warranting the need for emergent or urgent clinical attention. So a student in crisis. So those are the 3 tiers in the implementation plan that you're required to do. Next slide. Okay, continuing on with required activities, you have to develop an advisory board, and then they list out who all needs to be on that advisory board at a minimum. By the end of year 2, you have to develop a sustainability plan, because remember, this is meant to build infrastructure. It's not meant to be an ongoing funding cycle after the original 5 years. And then establishing collaborative relationships with groups like families, community groups, family and peer support services, behavioral health providers, and local businesses to really create that safety net for the school-age youth. Next slide. Okay, so all of those are required. Now they give you an additional 3 that are allowable. You're not required to do them, but you can use funding to do these activities. So providing supports to assist teachers and school personnel to develop their own skills that promote staff wellness, mental well-being, and resilience, so that teachers and school personnel are better able to support and refer school-age youth. Provide trauma and grief-informed evidence-based counseling and support services for LGBTQI+ children, adolescents, and their families' caregivers, including those who have survived sexual orientation or gender identity change efforts. And then lastly, in the allowable activities, provide developmentally appropriate training to youth addressing healthy relationships, healthy sexuality, and pro-social communication, including issues of mutual respect, consent, and positive bystander intervention. Okay, so those are allowable. They're not required. Next slide. Okay, so as I mentioned, this one does have a priority activity, so you get an extra 5 points. If you've implemented or plan to implement a student suicide awareness and prevention training policy in secondary schools. And it may include, as applicable, youth suicide early intervention and prevention strategies found in, and then this is a code section, 520E of the PHS Act as amended. And then you have to submit the requested information in attachment 9. So attachment 9 is simply where you're going to attach the policy that you either already have or that you're planning on implementing. And it can be no longer than 3 pages long. And something about SAMHSA is they're very, very particular about formatting. So things like this can only be 3 pages long. It can really only be 3 pages long, or you may not get reviewed at all. Next slide. So this just gives you a little bit more information about this policy. So it has to be evidence-based and culturally and linguistically appropriate. It has to provide evidence-based training to students in grades 6 through 12 in coordination with school-based mental health resources regarding suicide prevention, education, and awareness, including risk factors, methods that students can use to seek help, and student resources for suicide awareness and prevention. And this provides periodic retraining of students. So this is one of the allowable activities, but if you do it, you do get an extra 5 points, which can be a big boost considering how competitive this is likely to be. Next slide. Okay, so if any of you were part of the DOJ last week, we talked a lot about budgets and what's allowable or unallowable. SAMHSA is not as specific, so they're much more general. Like I said, this one, there is no match. There's various places where it says if match is required, then this, but there is no match required. What SAMHSA does is they have a template that they use for their NOFOs, and they don't necessarily update all the different sections to reflect this particular solicitation. So there is no match required, do not include match. There's also no required in-person meetings like there is for DOJ. And then I'm not going to read all this to you, but basically can't purchase drugs or things that can be used for drugs, can't pay for promotional items, and cannot pay for the purchase or construction of a building or structure. Next slide. And then cannot provide inpatient treatment or hospital-based detoxification, residential services, housing, but you can pay up to $30 non-cash incentive to individuals to participate in required data collection follow-up. And there is a salary cap of $212,100 for recipients and subrecipients, but that does not apply to consultants. All right, so let's talk about how to prepare. Next slide. Okay, You want to make sure that you've read the FY 2023 NOFO. There is a link from the Green Lights Grants Initiative website where you can easily get to that. If you're planning on doing this, you want to contact your state education agency and your state mental health agency about the project sooner rather than later. So you can start talking about what that would look like, see if you can get their buy-in, because if you don't get their buy-in, you're not going to be able to apply for the grant. You want to identify those other partners that you're required to have. So families, community groups, family and peer support services, somatic and behavioral health providers, and local businesses. You want to make sure that your LEA actually has the capacity for a project of this size. $1.8 million is a lot of money to infuse into, like, let's say, a smaller school district. So that is something to keep in mind. You want to make sure that you have quantitative and qualitative data about your need. So what sort of mental health issues are already present within your school body. You need to create a demographic profile of your LEA. So gender, race, ethnicity, age, things like that. You want to start looking at evidence-based practices and tools that you can use. And like I said, there are some links in the NOFO that you would be able to find those. You can also actually just Google SAMHSA evidence-based practices, which will take you to their evidence-based practices website. And then determine if you're going to go for the priority, see if you already have a suicide response plan, and if you don't, go ahead and start drawing up one. Okay, so that is it for Project AWARE. What questions do we have?
Hi, Stacy. Thanks so much for that. We have a couple questions here in the chat. The first one is, when we establish our community partnerships, do we have to get them to agree to having a 0.25 SEA coordinator and a 0.25 SMHA coordinator? Does that have to be listed in their agreement to partner?
No, so basically you have two different groups that you're partnering with. The one is the SEA and the SMHA that you have to partner with, and then they have to have those 0.25 FTEs. And then you have this other group of partners where you're creating that safety net in your local community. So they do not need to have staffing.
Great, thanks. The next question we have is, does the staff that you listed have to be from the agency listed, state, education, etc., or are they people in the program that are designated to work with those agencies?
No, they have to actually be part of those agencies.
If Arizona has a banned social emotional learning SEL, how are we supposed to fully implement the Tier 1 requirements?
So you have a ban on it, like you can't do it? Is that what they're saying?
Yes, I believe so.
Then probably this would not be the grant that you could apply for.
Do we have to address all three tiers of the public health model?
Yes.
Next question is, what if you already have existing components in place, i.e. behavioral threat assessment team, but you're wanting to seek or expand and enhance that?
Yeah, I think this would be a great fit then.
Wonderful. If our state has already awarded the Project AWARE grant to work with 3 LEAs and my district is not one of those LEAs, can we apply as an LEA?
Sure, I don't see why not. Yeah. Because that wouldn't be a duplication because you're a totally different LEA.
Next question is, by doing the priority area, will it make our application more competitive?
Yes. Like the 5 points, you'd be surprised how big of a difference 5 points can make. You know, I can't remember. I don't think they told us how many points are available to this, but let's say it's 100 and you only get 95 points. You get those 5 extra points. You now have a total of 100 points. So it does make a big difference.
The next question is, do those agencies then have to agree to allot, this is a continuation of an earlier question, do those agencies then have to agree to allot a 0.25 FTE person when they agree to work with us?
I would suggest yes, because since they're going to have that staff position, that you're going to want them to agree to that upfront. Because likely what they're going to do is take somebody who's already there and appoint them to be that position.
Can a school apply if they previously had a sub-grant through the AWARE program, but they're wanting to build on that?
Interesting. They don't actually say anything about that. I don't see why not. If you can build on what you did before as a subrecipient. Now they do say that if you got funding in the last 3 years, I think it was the last 3 years or 5 years, then you can't apply for it again. So it kind of depends on, you might want to double check with them, because if you were a subrecipient, then you were benefiting from it. So they might consider you to be ineligible. So I don't want to say definitively, because it might be something that you want to check with them.
Should I contact my state mental health agency now or wait until the solicitation is posted and open?
I would go ahead and talk to them now, even if it's just a preliminary discussion, just to get that door open so that they're familiar with you. Because if they're like adamantly, they're just like, nope, we're not going to partner with you, then there's no point in continuing on thinking that you're going to apply for the grant.
Great. Next question is, what if we have current mental health therapists who primarily focus on the tier 3 interventions, but we need a tier 1 and tier 2 focus of support to be more preventative? Are we a good candidate for this grant?
I could see that, yes, because you're showing how you're building upon something.
The next one is, if an SEA has no staff who can help, like at the main agency, but there are regional offices that are technically employed by the state education agency, but run a regional office, employees are technically county and municipal, would that
Right.
work as an SEA partner?
Again, I would probably check with them. To me, my gut says yes, they would, because if they are SCA employees, that counts. And it feels like a regional office actually would be even a better fit. But that was something I would definitely check with them about.
Another question we have here is, what recommendations would you have for a startup business that is partnered with schools and LEAs to improve mental health outcomes for students? They're looking to empower schools by being able to support the current successful pilot services they have being provided and expanded for students.
I'm not sure what the question is there. So is it what?
Would this
Sorry,
be
go
a
ahead.
good opportunity for them?
For the so they're a local business and they're trying to get engaged with local school districts, it sounds like. Yeah, I mean, I would reach out to local school districts because they may not even know about the opportunity or may feel too overwhelmed by it. So if you could reach out to them and say, hey, we have this that could help you, I could see that that could be really useful.
Great. Last couple questions here. The priority area of having suicide training policy, do we have to have one now, or can you plan to implement one during the grant?
So you have to have one to submit to get the priority points, but it doesn't have to have been implemented yet. But you have to have the written policy.
Last question I see here is, who would we speak with at our state education agency? What department should we coordinate with? And what are examples of state education agencies?
Why, like I know here in Virginia, we have a Department of Education. So that's probably likely what you're going to be looking for as far as who is that state education agency. As far as who you should contact, that's a little trickier. I would probably look to see if they have any sort of mental health staff or people that are looking at behavioral or mental health on staff. That's where I would start and see if there's something like that kind of position there. You might also be successful if you reach out to your state mental health agency. They may already work with the state education agency, so they also might be able to help you get an in.
Great. And then the last few questions that I will comment on are asking if we know a deadline for when this application will be released again. I just want to state that that's contingent on congressional appropriations. And although we are expecting it to come out similarly to the past years and their timeline, which is why you should review the 2023 Notice of Funding Opportunity, we don't have exact deadlines for this year quite yet.
Yeah, and normally SAMHSA projects, and they did not do a projection for this one.
That's all we have for right now for Project Aware. Thanks, Stacy.
All right, great. All right, so let's move over to mental health awareness training, MHAT. Next slide. So just as a reminder, this is up to $200,000 per year, up to 3 years, no match, no priority area, and they're going to do 22 awards. So as you can tell from the title, Mental Health Awareness Training, this one is all about training and education. So the overall, just taking on my time, the overall purpose of the program is to train individuals. This could be school personnel, emergency services personnel, fire department, law enforcement, veterans, armed services members and their families. And also remember, this is the one that's not specific to education agencies. This is open to a much broader population base. And then provide education on resources available in the community for individuals with a mental illness, and other relevant resources, including how to establish linkages with school and our community-based mental health agencies. So this is the one time where they do specifically call out schools. They're looking to increase the number of individuals who are prepared and trained on how to respond to individuals with mental disorders appropriately and safely. Next slide. So they have a number of populations of focus that you can use as your focus point. So teachers and relevant school personnel who interact with children and youth in a school setting. So obviously, if you're an LEA, that is one of the populations of focus you would pick. You could, however, partner with another entity and maybe expand on those populations of focus. So there's also law enforcement and emergency services personnel, institutions of higher ed, and families, caregivers, and service providers in contact with armed services personnel, veterans, and their families. Next slide. Also have parents and caregivers of children and youth with or at risk for a serious emotional disturbance or youth experiencing a first episode of psychosis. Primary and specialty providers of medical care who provide prevention and treatment services to the general public. And community leaders, faith-based leaders, and other trusted individuals and organizations within diverse racial and ethnic, sexual, and gender minority communities. So those are all the different populations of focus. Next slide. Okay, so like I said, you can pick one population of focus. You're not required to do more than one. As I said, this grant is not specifically for LEAs. So some thoughts that you could have is you could work with your county or city, including local law enforcement, to pair up to apply for this grant. So you wouldn't have to be the lead on it. You could be the lead of a collaborative project, or you could just decide to apply on your own with the required partnerships and just focus in on your own schools. And the only key personnel for this proposal is 1.0 FTE project director. Presumably that would be in the LEA, but they don't specify that. Next slide. Okay, again, they have a series of required activities. So you have to do mental health awareness training. And they do actually give you, there's a link in the notice of funding opportunity embedded in the required activities, but like one of them is mental health first aid that you could do as an evidence-based program. You also then have to identify the population of individuals who are going to receive the mental health awareness and training and the population of focus for whom they are being trained to recognize the signs and symptoms of mental illness and how to respond appropriately and safely. So you might pick the population of individuals being teachers, and then the population of focus is youth in schools. Next slide. You need to identify resources and supports in the geographic catchment area and develop written and electronic materials for the individuals being trained so they can assist the selected population of focus. So it's not just, I come in, I get trained, and that's it. You need to also have written and electronic materials kind of to reinforce the messaging for them to be able to go back to if they have any further questions or something comes up where they need to respond to a mental health crisis. And then establish mechanisms that increase the ability of individuals trained to refer and link the population of focus to behavioral health resources. So, for instance, if a student does disclose that they're having a mental health issue, that teachers would be prepared to know exactly where to refer that student. Next slide. Continuing on. You have to develop and implement a mental health awareness training plan. And then there's a series of things that has to be included in that training plan. So the curriculum or evidence-based practices to be used for mental health awareness training that are culturally and developmentally appropriate for the population of focus. Has to include the processes to be used to refer and link the population to mental health resources and services, identification of de-escalation strategies, and process to evaluate improvements in knowledge, attitudes, and belief as a result of mental health awareness training. So doing things like pre-post tests. Next slide. And most evidence-based trainings do already have that element built in. Okay, the training plan continuing. It also has to include a process to be used to track the number of linkages of the population of focus to mental health resources and services, has to identify community outreach and engagement strategies to ensure that participation in mental health awareness training results in a broad representation of community members and broad representation of individuals who reflect the diversity of the selected population of focus. And last up, it has to include a description of culturally and linguistically appropriate resources. Next slide. Okay, so going back to, so that's the whole plan. Those last two slides are the training plan that has to be developed. Now we're back to the required activities. So, like I said, this one also requires a partnership, and it has to be with relevant community agencies to assist with responding to mental health issues and improve coordination of services. So at least one partnering agency needs to be an identified licensed mental health provider on staff being able to respond to training referrals made a result of the award, and need to have letters of commitment from those entities. So basically saying you're going to train a bunch of people, then they're going to be prepared to refer. You need to make sure that whoever they're referring to does have the mental health provider on staff that can actually handle those referrals. And then utilize social media for dissemination of mental health awareness information, resources, training opportunities, community outreach activities to decrease stigma related to mental health. Next slide. Okay, so all of those were required. Now, similarly to Project AWARE, these are the ones that are allowable. They're not required, but they can be undertaken. So basically, the first one is about sustainability of the mental health awareness training and delivery of mental health services. Develop and implement evidence-based social marketing and awareness campaigns to reduce stigma. And build capacity to sustain community-based mental health strategies to support the provision of mental health services for the population of focus. Next slide. The budget considerations are the exact same ones as they are for Project AWARE, so I'm not going to read all that to you. But again, there's no match requirement. Next slide. And then next slide. Okay, how to prepare. Again, you're going to read the 2023 Notice of Funding Opportunity. You have to identify at least one local community-based behavioral health partner that has licensed mental health providers. You need to collect data, quantitative and qualitative, about your need. What are the training gaps and needs? Similarly to Project AWARE, you need to create a demographic profile of your LEA and identify evidence-based trainings that you're going to use. And like I said, there is that link to a website that does list out a variety of trainings that you could choose from. And pick your population of focus. So again, is it just within your school? Are you going to partner with another entity that it could also be outside your school? So that's it for MHAT. What questions do you have for me?
Hi, Stacey. Okay, a couple questions for you. If we are looking to apply for this grant, do we need to train individuals outside of our school districts?
No.
If we have the mental health awareness training plan developed, or do we need to have the mental health awareness training plan developed prior to applying for this grant opportunity?
No, you do not. That is part of the activities that you'll be required to do during the grant.
Okay. For either of the grant opportunities, do we have to request the maximum grant award amount?
No, you can request whatever amount that you actually need.
For both of the opportunities, can a consortium of LEAs apply? This example in particular, they're a network of charter schools, and each of their schools have their own LEA.
I don't see why not. There's nothing in there that says you can't, and I think that could actually strengthen your application.
Next question is, what are some evidence-based practices and where can we find them?
Okay, so I mentioned one, mental health first aid is one. And like I said, there is a link in the MHAT NOFO that goes directly to an MHAT website that lists out a variety of evidence-based practices.
Next question is, what are some examples of the community outreach and engagement strategies we can use?
Well, it would depend on your project. If you're just going to stick with your school district, then it's really just within your school and reaching out to parents, family members, caregivers. If you're going to go out to a broader audience, then you might have to consider, okay, how do we engage them? What are the community groups where it's like local community groups where they're already going out into the community? Like I could see like church groups or things like that, that they're already respected within the community. So those community leaders could also be another option.
Okay, next question we have here is, if an LEA has a licensed on-site mental health provider, is the LEA still required to partner with an outside agency for the licensed provider piece?
I would suggest yes, just because if you start to get a lot more referrals due to screening and much more training, then that licensed mental health provider may not be able to do them all. But that is one of those things that I would ask that question of SAMHSA. I'm pretty sure they're going to say yes, you still need that partnership though.
And last question I see here. So if you have any other questions on the mental health awareness training opportunity or any of the two opportunities we talked about, please be sure to put them in the Q&A box. But the last question I have for you here is, can you remind us of the match requirements for both of the grant opportunities discussed today?
Neither one of them requires match, so that makes life a little bit easier.
Wonderful. Well, I'm not seeing any other questions come in, so I think this concludes our Q&A portion.
Okay, great. Well, that's all I have. So this week we're just focusing on 2. Last week we focused on 3 from DOJ. Again, the MHAT is open to all sorts of different types of entities, and there's only going to be 22 awards. And the Project AWARE is open really just to LEAs to partner with their state education agency and state mental health agency. There's a lot more money available, but there's a lot more required activities and partnerships in order to make that happen, to develop that infrastructure and safety net for the students.
Wonderful. Thank you so much, Stacy, for all that great information. As more questions arise, folks, feel free to email info@greenlightsgrantinitiative.org, and we will work with Stacy and our other grant experts to make sure we can get those answered for you. And this webinar, as well as additional resources, will be posted to our website by the end of the week. So be looking out for that. We really hope you'll join us for our next webinar, which is on Department of Education grants on March 5th. So in 2 weeks from today. And in the meantime, we will be sending out any emails and updates as they come on grants and grant information. And we thank you for joining us today. And we hope to see you next time. Have a good day.